Okay, welcome back to Live Wire. I'm Jared Moore, and this is Mvskoke Media's Live Wire. We're going to do a COVID vaccine update today. Joining us via Zoom is Shoneen Alexander-Ross. She is the Chief Performance Officer for the Mvskoke Creek Nation Department of Health, and we're also going to have Samuel Hubler, Director of Outpatient Pharmacy Services at the Okmulgee Indian Health Center. So thanks so much for joining us today, guys. Appreciate it.
Thanks for having us, Jared.
Okay, so let's just start off. And whoever wants to field this can field it. Where are we at in the vaccine distribution process at the Creek Nation right now? Like, can you give us just kind of a general update?
Absolutely. So we are in the thick of it, to be quite frank. We are giving out plenty of first and second doses, but now have really started in heavily with the third dose and the booster doses for all of our patients here at Mvskoke Nation Department of Health. So we've been giving them out pretty much every day at each of the clinics.
Okay, and could you kind of parse what the difference is between when you say third dose and booster? What are the difference between those two things?
Absolutely. So most of our doses, so Pfizer and Moderna, require 2 doses to be considered a complete series. If we have a patient that is immunocompromised, so someone that may have had a transplant or is currently under cancer treatment or taking high-dose steroids, something that would limit their immune response to the vaccines, they are eligible for a third dose that's 28 days after they completed their initial series. And then for the rest of us that had the first and second dose, it is a booster dose, and we get that 6 months after we finish our series. Those people that have had the third dose, they're eligible for a booster after 6 months as well. So in essence, they will have 4 doses of either Pfizer or Moderna.
Okay. And as far as the booster shots for the general public, what are the qualifications for that? Are there recommendations for people?
Sure. Did you want that one, Shoneen, or do you want me to grab that?
Sure. I'd be glad to jump in, Sam, and help you. Absolutely. We're able to offer the booster to those that are 65 and older, those that are 18 and older that are in long-term care settings or have underlying medical conditions, and then those that are 18 and older that live or work in high-risk settings. And someone had asked me, what is a high-risk setting? What does that mean? And so what we're talking about is maybe those folks that are working on the front lines, that are first responders, that maybe work in the public school system, so their education staff, correction workers, postal workers, public transit workers, those individuals that are interfacing with the public on a consistent basis.
Okay, and the boosters and the third dose too, those are all going to be things that the practitioner that you're seeing at the clinic is going to tell you which one you're going to get. For people who maybe they don't know for sure if they should have a booster or not, should they just call their local IHS clinic, or what should they, is there somewhere a hotline they can call?
Absolutely. So I'll jump in, and then maybe Sam wants to add to the conversation. So we do have a vaccine information line. If someone is interested in learning more about the vaccine, or if they want to sign up on the list and have the clinic contact them to schedule them for their booster or their third dose, I can share that information with you, Jared, and we can get that number out.
Okay.
Individuals can also go to our website at creekhealth.org and go to our COVID-19 page, and I promise you'll have more information there than probably what you want to read through. We talk a little bit about boosters. We're getting that information out to the public. We're also talking about how you can follow our events that we're having in the communities. for flu and for COVID. So there's information on there about how you access your vaccine, what numbers to call. If you want to bring some family to a community event and get the flu shot and the COVID, there's information about that as well. And of course, if individuals want to follow us on social media, the Mvskoke Creek Nation Department of Health has a Facebook page, and we are putting information out there frequently.
Okay. And with that hotline, just for the audience, after this stream is over, once I got that hotline, I'll put it in the description for the video down here. So, and you're going to jump in there, Mr. Hubler?
Sure. So I would say if you do not find the answers that you want there on the website, please call the clinic that's closest to you, because each clinic's staffed a little bit differently, and they have their vaccine schedules set up according to what works best for them. So some clinics do like all Pfizer vaccines, say on a Wednesday, and then Moderna on Thursday. But each clinic is different, so I would have them call the clinic that's nearest to them or the one that they frequent, and make sure that they schedule or find out what day they should show up.
Okay, great. And go ahead.
Jared, I would just add, I have that number and I shared it in the chat.
All right, let me see if I can.
758-3601, and that's the Mvskoke Creek Nation Vaccine Information Line. It's an automated line, so all the content on there is pre-recorded, but you are able to actually leave a voicemail. There's options that discuss the types of vaccine that we have. Of course, everyone knows we have Pfizer, we have Moderna, and we have the Janssen vaccine. But it does give some education on the different types of vaccine. It also gives you the option to leave your name and a return phone number for us to call you back, and we'll help you get scheduled. And for those that are interested in learning a little bit more about the side effects of the vaccine, et cetera, that content's on there as well.
Great, awesome. So, and thanks for popping that in the chat. I was able to get that up on screen. Everybody could take a look at it. We also saw earlier this week that the children's vaccine for 5 to 11 got approved. What's the plan on the rollout for that on the Creek Nation side?
So yeah, some very exciting news. I saw the UPS truck drive up onto the dock before I came up here. So some has arrived on site. We plan on making sure that all staff is aware of all the changes. It is a different formulation. Storage is different. The amount of doses that come per vial are different, and the length of time that it is good once you draw it into a syringe is different. So once we have had the opportunity to train and test all the staff on those competencies, we'll be rolling those out about Tuesday of next week is probably the earliest that we'll be able to get that done. Okay. So we encourage people that have kids of that age, 5 to 11, to go ahead and reach out to their pediatricians at the clinics. They're going to be the ones that are going to be handling most of those doses, so they can go ahead and get those scheduled.
Okay.
And get those youngsters taken care of.
And with the child vaccine dosages, those are going to be done through the pediatricians. Do you guys think we're going to see like the drive-up tents and stuff like we saw with the previous rollout?
So I would not foresee so much the drive-up, mainly because of physiological differences in pediatrics and adults. A lot of those smaller kids will end up getting those doses in their thigh. And so, having them, remove their pants or, in the cold weather, it's not an optimal time to do that for those kids. So right. That's why we're working heavily with those pediatricians. And it'll be a great time to also make sure that they're caught up on any of their shots, and they'll have an opportunity to be seen one-on-one with a pediatric staff member, which is great.
Awesome. Well, I want to take an opportunity while we're talking here to let everybody that's watching us on YouTube know if you got any questions about the vaccine rollout, whether it's about the third dose, the booster shots, or the child vaccines, just go ahead and pop your questions into the chat. Is there anything that we haven't mentioned so far about the vaccine rollout that you guys think is important?
I would just add, Jared, I think we're still encouraging all of those that have not come forward to get their vaccine. We're still giving primary doses, so please reach out to your clinic. We feel that is so important. We're also offering the annual flu vaccine, so if that's something that someone is interested in getting, we can do that at the clinic as well. And we do have some community events that are still ongoing. So for those that have maybe been a little bit hesitant, we do have the medical leadership and the pharmacy staff in the facilities that are able to answer questions that they may have if they're concerned in particular about taking the vaccine. So we're still urging those that are unvaccinated to please come forward, because we want to move forward and out of this pandemic and return to what we know as a normal life.
I kind of had a question along those lines too. From the perspective of the health system, we've seen a lot of articles and I guess you say speculation about COVID becoming endemic and being something that's kind of like the seasonal flu where you would go and get a shot for it. Is that something that you guys think is going to happen in the future?
No, that's I'm with you. I've read lots of articles and spoken to a lot of experts, and I think we just don't know yet. I think that the way it's gone over the last year and a half, almost 2 years now, that's kind of the way it's looking. I'm still holding out and being optimistic that we can whoop this and put it behind us. But I'm also a realist that it may be something we may have to live with, and we'll just do the best we can and prepare ourselves and arm ourselves with the best tools to fight it, which, for now is masking and immunizations, washing our hands,
Yeah.
pretty much the same thing we do with flu.
Absolutely. And we talk about it all the time, within the health system. We feel like the vaccine is one of our best tools, to help move forward. But Sam's absolutely right. We just don't know. And it's something that we want to make sure that individuals, have the information they need to make the best decision for them. But we're following that closely, and we're hoping and optimistic that those that are unvaccinated will decide to come forward and accept the vaccine, and they can protect themselves and their family. We know that when the schools returned in August, we experienced a spike. And although the positivity is continuing to go down, we still are having folks test positive. So, it's not out of the community completely. And so it's still an opportune time to accept the vaccine and protect yourself, especially as we go into Thanksgiving and to Christmas and to the new year. And I don't know about you, Jared, but I'm excited to be able to gather with my family, and I want to do it safely. I want, my extended family to be safe and that sort of thing. So the vaccine is readily accessible for those that are thinking about those family gatherings.
I think that's at the top of everybody's list, really. And we were talking about the downward trend in the daily positivity case rates in Oklahoma in particular. And do you guys, what's your opinion on a winter surge? Are we going to see those numbers come back up in December, or do you think this is going to hold, since we're seeing more this new rollout of vaccines, right? Are we going to keep going down, or is there a possibility to come back up?
Well, I think that we do have a big possibility of a surge, just because of, closer quarters. We have other respiratory illnesses that are going around during this time. But because of the amount of people that have come in and have been immunized, I would expect that surge to be less than it was, say, a year ago. I would expect us to have made significant progress. But again, it will take plenty of people receiving their vaccinations and making sure that we're washing our hands really well. And if we're feeling sick, to stay home and, be a little bit selfish or selfless at that point, and not go out when we are sick and spreading whatever illness we may have.
Gotcha. Well, I want to thank both of you guys for coming in to Zoom today for the live stream. We're still, where are we at here? About 14 minutes. is there anything else that we haven't touched on in relation to this? Because I've pretty much covered all of my information.
So I did notice that on my notes, on the boosters, I didn't talk about heterologous mixing or being able to get a different type of vaccine for your booster.
Okay.
And I think that's a very important thing. Once you've had either your Pfizer, Moderna, or your Janssen primary series, and you're ready for that booster, you can pick any of the three to get the boosters. So the Pfizer continues to be a full 0.3 mil dose. The Moderna is a 0.25 mil dose, or a half dose. And then the Janssen or Johnson & Johnson is a full 0.5 mil dose. And like I said, you can mix and match those for your boosters. So they've had a lot of studies come out of Europe and several newer studies here in the US that show an increased immune response when you booster with a different type of dose. Or maybe you have somebody that, didn't feel real well with, say, the Pfizer or Moderna, and they want to try one of the other doses. That's perfectly fine. So when you do call to set up your appointment at one of the clinics, they can pick from that day, or if they want to talk to their provider, which one might be best for them, because there was some issues with the Johnson & Johnson in childbearing years, those women with blood clots and things like that, and with Pfizer with myocarditis. So if the patient has concerns with those, that's perfectly legitimate. We can talk about those and recommend what would be the best for them to do on their booster.
And just speaking about that, how long will the booster last you? Like, what's the window there? Like, you say you get your booster, then how long are you going to have guaranteed or 90% immunity?
Sure. So far, they've found that about 6 to 8 months following your last dose is about the length of time that you will have sufficient antibodies. After that time, there is some waning to the immune system that goes on. So we start losing some of those antibodies after about 6 to 8 months. I see.
Well, that pretty much covers everything for me. Once again, thanks so much, guys, for coming in today. And if you guys got everything out that you need to get out, I've covered all of my questions. And I just want to say also, from me personally, I appreciate all you guys, the hard work you guys are doing out there on the front lines. I know that that's probably one of the most dangerous places to be during this pandemic, is seeing patients and being out there and working in the health system. So Mado from me to you guys too, just personally. So with that being said, I don't see any questions that popped up in the chat, so we're going to sign out today. And we have another live wire scheduled for next Tuesday at 10 a.m. with Dwayne Meadows. We're going to talk about the diabetes virtual summit that's going to be in a new place this year that's not on our channel, but there'll be some surprises there. So if you have any questions about diabetes prevention or where to get information about that, make sure to tune in next week. And with that being said, Mado, and we'll see you guys later.